Hi, I'm Dr. David Stoker, a board-certified plastic surgeon in Los Angeles. Today, I'd love to share with you a beautiful example of a mommy makeover on a mother of twins who had an extreme diastasis recti. Let's check it out. If you look at these pictures, you see a 35-year-old beautiful mom who desired three key things. One is a breast lift. Number two is a tummy tuck repair of her abdomen, including both the muscles as well as the skin and fat. And the third is 360-degree power-assisted liposuction. She actually ended up not doing the liposuction for this mommy makeover, so let's focus on those first two procedures. The breast lift, you can see, is just a beautiful result where we raised the nipples, kept everything beautiful and even. She's got a beautiful, perky, full breasts, and accomplished her goal of restoring her figure. I think the most impressive thing about this case, though, is the severe diastasis recti. Check out the profile in the oblique views on this case, where you can really see the abdominal muscles, basically two rectus abdominis muscles, or belt-like muscles in the front of the abdomen, the six-pack muscles. They're split so severely you can see her intestines and other internal organs bulging out, an otherwise very skinny mom. There's nothing she can do to improve that short of surgery, so that's what we did. The diastasis repair here was a multi-layered procedure where we brought her probably about 4 or 5 inches in, I'd say maybe 5 inches in her case, to bring in that tight waist, give her that snatched appearance. We restored the appearance of a normal belly button. We got rid of all of that excess skin, lifted and tightened her pubic area, and the combination is profound. She looks great in a bikini again. The other key thing to know about diastasis repairs is that it's not just a cosmetic thing. It can ache and it can be uncomfortable to do some core exercises like abdominal crunches or Pilates. But the other thing that happens when the muscles are not in the appropriate position in the front, patients are much more susceptible to lower back injury. And lower back pain is one of the most common things that people suffer from as we age. So it's one more major reason to deal with a significant diastasis recti. For her, I think appearance alone made her one very happy mom. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles.